Hi, my name is Boris Schmidt. I'm an interventional electrophysiologist from Frankfurt, Germany, and my hospital is CCB. Today we will be discussing the results of the ASTRO trials. ASTRO stands for Ablation Strategies in Patients with Atrial Fibrillation Despite Durably Isolated Pulmonary Veins. Despite technological advancements, a considerable number of patients are still suffering from atrial fibrillation after a catheter ablation. And if patients return for repeat catheter ablation and the operator finds all pulmonary veins isolated, there's a lack of data regarding the appropriate and most successful ablation strategy. In a German multi-center prospective randomized study, we screened more than 300 patients with atrial fibrillation after one or more catheter ablations. And after confirming pulmonary vein isolation, we randomized these patients to either an individualized strategy with voltage-guided catheter ablation using irrigated radiofrequency current, or an empirical strategy isolating the left atrial appendage with the cryoballoon, followed by interventional closure. The patients that we investigated were 2/3 of patients had persistent atrial fibrillation and 1/3 had paroxysmal atrial fibrillation. Today at EHRA, we will present the data of the ASTRO trial, and the main finding is that there was no statistically significant differences between the two approaches, and we could not confirm the hypothesis that left atrial appendage isolation using a cryoballoon is superior to a voltage-guided ablation. The key take-home message for me is that to date, we still do not have the answer. What is the most optimal ablation strategy for patients with durably pulmonary vein isolation? And incorporating new technology, we need to continue our research in this field. Given the results with numerically less complications in the substrate-based ablation approach, it is very unlikely that empirical left atrial appendage isolation will enter a guideline recommendation as first-line therapeutic approach to these patient population. The most compelling question that remains is, how can we find an appropriate strategy for patients with durably isolated veins still suffering from atrial fibrillation? And I guess future research is needed in terms of understanding atrial fibrillation mechanisms and more durable ablation strategies for these patients.